Hello, I'm Dr. Jeff Orr, orthopedic surgeon and sports medicine specialist, and I'm here today with your Barton Health Peek. The ACL is a ligament in your knee. It's one of many. It helps control anterior translation of your tibia and rotation across your knee as well. Throughout normal function, your tibia will tend to slide forward across your femur. With the ACL, it helps control that motion. If your ACL is missing, then that can lead to a feeling of instability and decreased function. When participating in sports, your ACL is at risk, particularly when you're in positions of full extension or flexion, such as if you have a fall or if you come to a sudden stop. When you combine this with a twist or bend across the knee, the ACL is subjected to a lot of force, which can lead to an injury. Following a fall or a perceived injury, if your knee has a lot of swelling, pain, or feeling of instability such as giving way or giving out, we do have an increased concern that there might be an ACL injury in your knee. Oftentimes, but not always, there may be an associated feeling of a pop or giving way of the knee, and that is a high association with an ACL injury. When there's an injury to an ACL, it doesn't always fully tear. Sometimes we have a partial tear where some of the ACL remains intact. That is important to distinguish, as that might guide treatment down the road. When we see a patient in the office, the most important thing is to establish an accurate history of the injury to their knee, whether there was a fall or a trauma or a direct blow to the knee. After that, there's a series of diagnostic exams that we will do as well. We establish range of motion, we check for stability, and if there's any tender spots in the knee. Following that, we'll typically look at imaging, which can include x-rays, and if it's warranted, we'll get an MRI as well. Once an ACL injury has been established, there's a range of treatment options for this. Non-operative treatment is an option if there's a partial ACL injury or for low-demand patients. We typically will start off with bracing and physical therapy. After about 6 months, patients who choose to go this route will start being worked back into doing sporting activities. For higher activity patients, or for complete ACL injuries with a high degree of instability, surgery might be the better option for them. This is typically done arthroscopic, where we make small incisions in the knee, and we're able to do most of our work through those incisions. Treatment specifically for the ACL will involve either reconstruction of the ligament or possible repair. When doing repairs, sometimes we'll use a bare implant, which is a bridge-enhanced ACL repair. This may be appropriate for some patients. Following an ACL repair or reconstruction, it's important to participate in physical therapy. We typically will get patients started within the first couple weeks of their surgery, and therapy can last 6 months, if not longer. The goal is to get patients back to doing every activity that they would like to do. There's no anticipated functional limitations for patients after successfully completing a rehabilitation after surgery. Course of physical therapy will vary patient to patient. It's important to be in close communication with your doctor to make sure that you're participating in physical therapy that's correct for you. The best ACL tear is the one that doesn't happen. Preventing an ACL injury does take a focused effort on exercise, strengthening, and flexibility. This should be started before your activity that you'd like to do. Lower leg strengthening and core strengthening is important, and flexibility, particularly across the hips, knees, and ankles. For more information, please visit bartonhealth.org.